Wearing masks on public transit, how to think about it. My thoughts, this is Dr. Noha Polack. I'm a pediatrician, Union City and Bayonne, New Jersey at Progressive Pediatrics. Dear patients and friends, I want to let you know that I am going to continue to wear my N95 masks in some situations on public transit. I'd like to discuss that today with you. What happens on an airplane? I think that an airplane is actually safer than other forms of transportation because there's much better filtration and ventilation on an airplane. By code, they have to do this. So if you're going on an airplane, consider wearing a mask if you're high risk. And I myself, if I do go on an airplane, will continue to wear my N95 mask, even though I think the filtration and ventilation are pretty good. Because if someone is sitting right next to you or right in front of or behind you and is infectious, that means that you could still get the infection. But if someone is far away from you, it is much less likely for you to get that infection because the ventilation and filtration is so good on an airplane. I am also very cautious in airports as well as online to get onto the plane, you know, that little tunnel that you have to go through. So I always wear a mask in those areas too to keep myself safe. So it's up to you what you do regarding masking, and it really has to do with your level of risk tolerance. If you can tolerate the risk because you're healthy, you don't live with anyone very young or very old or anyone immunocompromised, your choice will be different from mine. I work with newborns. I must be extra careful, and I will continue to do so. And so will the rest of the staff here at Progressive Pediatrics. We always wear N95 masks in the office, around each other and around our patients to protect everyone. In terms of trains are also good in terms of air ventilation and filtration. So if you are in a car, in a train car or a subway car, and there's not a lot of people in it and you choose not to wear a mask, it's a little bit risky, but not very risky. However, if you enter a subway or a train car and it is really packed with a lot of people in it, then your risk does go up. So I would consider wearing an N95 mask in that situation. What about buses? Buses are probably the worst case scenario if their windows are closed. If you have to take a bus, I understand that, but please consider wearing an N95 mask, even if you're the only person wearing that mask on that bus, because if the windows are closed within 45 seconds, one person's cough is spread to the entire bus. So if the windows can be opened on a bus and the air condition turned on, that is a much better situation. However, if all the windows are closed on a bus, I would recommend that you wear an N95 mask, even if you're the only person wearing that N95 mask, because the studies have shown that a really good N95 mask can still protect you if you're the only person wearing it. And it's absolutely better than nothing. So what about riding in a taxi or a rideshare like Uber or Lyft? In that situation, it's really important to have the windows open as much as possible. And to maximize your safety, I would wear a mask in that setting, as well as have the windows open and the AC on. So yes, a lot of people don't want to have the windows open and the AC on and wear a mask, but these are layers of protection for you, especially if you have young children. That's my opinion. So how do I think about it when I see people around me wearing masks? I try my best not to judge. So first of all, if you choose to wear a mask, please understand there are people around you not wearing a mask because they don't have the same risk tolerance as you. Also, that they just don't have as many people around them that are at high risk. But if you see someone wearing a mask outside, please try your best not to judge them, because you don't know if their partner or their grandparent is immune compromised and they're trying to protect them. So my message to the community is, I know the laws say you don't have to wear masks on public transportation, but if you choose to wear a mask, I would choose an N95 mask. And I myself am choosing to do that in situations. If it's on a crowded bus, absolutely. If it's a train that's not crowded, then it's optional, your choice. But if it's a crowded train, crowded bus, crowded anything, you should consider wearing it. And that on an airplane, it's not a really high risk unless you're sitting close by to an infectious person. And consider the fact that in an airport or in a crowded tunnel to get onto the plane would be your biggest risk. I hope this helps with your choice about where and when to wear a mask, and the kind of mask to wear I recommend is an N95 mask. I hope you have a wonderful day. This is Noha Polack from Progressive Pediatrics. I want you to please call us with your questions. Use the patient portal and contact us at your leisure. And also know that we're open 7 days a week for you in Union City and 5 days a week in Bayonne. And we love to take care of your family and your children. Give us a call. Have a great day. Bye-bye. And there are people around you not wearing a mask because they don't have the same risk tolerance as you. Also, that they just don't have as many people around them that are at high risk. But if you see someone wearing a mask out, I want you to please call us with your questions. Use the patient portal.